What to do if you are allergic to pollen. Allergy to pollen, or hay fever, is a seasonal disease that is clearly manifested during the period of active flowering of various plants. Caused by pollen that acts on the mucous membranes of the eyes, nose, and upper respiratory tract. The immune system mistakenly perceives pollen as a danger and gives an extremely strong immune response. It begins to actively produce antibodies to fight the imaginary enemy. The body rapidly produces histamine, which provokes various allergic reactions. There are several so-called pollen waves. From March to April during the flowering of deciduous trees. From May to July, when it is the turn of cereals and meadow herbs. From August to September during the flowering of wormwood, quinoa, corn and sunflower. Pollen allergy symptoms. Allergic rhinitis, manifested in frequent sneezing, runny nose and nasal congestion. Conjunctivitis, which is characterized by discomfort, swelling of the eyelids, redness, tearing and burning of the eyes. Shortness of breath, cough, wheezing. Causes. Among them are hereditary predisposition, weak immune system, chronic pathologies of the respiratory tract, severe, unhealthy working conditions in chemical, industrial production. Pollen allergy treatment. There are many remedies that allow, if not to get rid of it for good, then at least alleviate the symptoms of hay fever. This. Antihistamine medicines. Nasal sprays. Devices for washing the sinuses. Eye drops. Those suffering from severe allergies are usually prescribed medications in two forms. Sublingual tablets. Allergy shots. They are an effective means of immunotherapy. They are a series of injections that reduce sensitivity to allergens and reduce symptoms. This is a long-term therapy that takes several years. In any case, before starting medication, it is necessary to consult an allergist to determine the severity of the allergy, select the appropriate treatment tactics, monitor its effectiveness and correct therapy if necessary. An important factor in successful treatment is the early start of taking medications. For example, if an allergy usually manifests itself in April, the doctor will recommend that the patient take medication from March. Such preventive measures will help to significantly reduce the symptoms of allergic reactions. In addition, there are a number of other rules, the observance of which helps to alleviate the condition with hay fever. Do wet cleaning in the house as often as possible. Use a humidifier to keep pollen and dust out of your home. Wash your hands and face thoroughly after being outdoors. Shower at least twice a day. Returning from the street, immediately change into home clothes. In hot and dry weather, a lot of pollen accumulates in the air, so on such days try not to leave the house unnecessarily. The best option is to leave for the flowering period in another region in which there are no herbs or trees that cause allergies. However, it is worth remembering that some plants belong to the same botanical group and can provoke similar allergic reactions. Therefore, it is worth carefully studying the flora of the region in which you are going to hide from hay fever. Pollen allergy is an unpleasant seasonal disease, the symptoms of which can still be alleviated if you follow all the doctor's recommendations and strictly follow the rules that alleviate the condition with hay fever.